Now, we chose to focus our deep dive discussion today on what it would take to reverse Nigeria's healthcare sector challenges in light of the prospect of a new incoming administration. But let's start by taking a look at some statistics showing the economic implications of an underdeveloped health sector. Despite numerous reforms, Nigeria's healthcare industry's contribution to GDP over the past 5 years has remained relatively low at less than 4%. Today, healthcare expenditure is somewhere around 3% of GDP. Although an increase on previous years, only 5.75% of the total budget is allocated to the healthcare sector in Nigeria. And finally, according to the World Health Organization, Africa shoulders 25% of the global disease burden and yet only accounts for only 1% of the global financial resources for health. These figures point to the industry's underperformance, which is caused by, amongst other things, poor infrastructure, insufficient budget allocation, and the medical brain drain, all of which also continue to contribute to outbound medical tourism. Joining me to put some perspective on the state of the healthcare sector and the opportunities that exist to change the narrative and adequately fund the sector are Dr. Ola Brown, who was here before on the show. She's the CEO and founder of HealthCap Investment. And with me in the studio is George Uduku, also a medical doctor. He's the general manager, West Africa at GE Healthcare. So great to be speaking to you both, and Dr. Ola again, of course. George, I want to come to you first. So if there's one thing that you would say is the biggest driver of the challenges we face in Nigeria's healthcare sector today, what would you say that one thing is?
Thank you, Rolake. Good morning. Thanks for having me. That will be demand financing, health insurance. The gaps in health insurance is the biggest root cause of all the challenges we face in healthcare today. Without health insurance, an investor is not guaranteed predictable and quantifiable revenue streams that ensures a return on their investment, right? And without investments in technology and clinical staff, you have a quality issue, right? And without quality, you also have a confidence crisis. And with a confidence crisis, you then have the outbound tourism that we all observe today. Now, whether the health facility is set up as a for-profit center or non-profit, it needs to be financially viable. It needs to be financially sustainable. And I give you an example. So an MRI machine costs about $1 million plus minus. In the US, the average cost of an MRI scan is about $400 to $1,000, depending, right? And this is almost entirely covered by insurance. And these equipments are handling case volumes of up to 33 scans per day. Now, we come to Nigeria, the average cost for the same scan is about $100. And this is largely out of pocket. Now, even at these low amounts, a lot of people cannot afford it, right? And this is largely out of pocket. And what happens is that our hospitals around here are only able to achieve barely 33 cases per month, right? So when you start to solve the issues of health insurance, you start to really address some of the fundamental issues around the sector.
Somebody is subsidizing that gap. And from an investment perspective, it doesn't even make sense when you compare the cost. So I certainly understand that. Now, Dr. Ola, looking at some of the stats that Dr. George quoted, what are the actual economic implications of underinvestment in Nigeria's healthcare sector?
Good question, and thank you very much for having me back on again to talk about my favorite subject. So I think that Mr. George was right in terms of talking about demand financing. I think that that's the greatest problem. But I wouldn't necessarily say it has to be insurance-based. I think that the greatest problem is demand financing, but an even greater problem is political will. There's no country on the face of the earth that has achieved universal health insurance without its government making healthcare a priority. Healthcare everywhere in the world is a priority for government. Government in America spends 10% of GDP on healthcare, over 10% of GDP on healthcare. 30% of people in America are not covered by insurance, they're covered by the government. If you look at the breakdown of the American budget, you find out that Medicare, Medicaid, the government-backed healthcare systems are actually a huge proportion of the total budget. So why do the Americans, why do the British, why do the Japanese, why does every developed country on the face of the earth focus on healthcare as a priority? Because they know something that we are yet to fully find out, which is that no country achieves security, achieves decent employment, achieves economic productivity without investing in healthcare. The person that actually came up with the concept of the NHS in the UK wasn't a doctor. He was an economist. And the reason why he felt that the government-backed healthcare was so important to the UK was in order to be able to compete with America on an equal level. And he knew that sick people would not be able to compete. In America, 1 in 8 people in the entire country work in hospitals. So it's not just a healthcare industry, it's actually a real economic lever that employs over nearly 20 million people across America. So this is an important industry. The NHS is the government healthcare system in the UK, but it's also the biggest employer in Europe and the 6th biggest the 6th biggest employer in the world. So healthcare does not just mean better healthcare; it means jobs, and jobs mean security. So this is why I say that investing in healthcare can solve all of Nigeria's problems,
Yes,
not just the healthcare
indeed.
problem,
Yeah.
the economic and security problems as well.
And there are 2 parts to this issue of investing, because there's a part of healthcare education and the university system and the training and all of that. Then there's the issue of the brain drain. Why are so many of our qualified medical professionals finding opportunities elsewhere? So there's 2 questions, and I'd like both of you to come at it from whatever angle is. The first of all is, between private and public investment, who is going to shoulder the burden of investment in this sector that is so underfunded? We've seen the statistics. And secondly, are we actually getting it right in terms of how we invest in healthcare education?
Right. Look, I think in answering this question, it's important to look at countries with better outcomes, okay, and see what works and what doesn't work. What you find is a blend of public and private sector investments, and the proportions differ between countries. Now, some countries like the UK are almost entirely public sector driven, and these are countries where you have efficient tax collection mechanisms. And in other countries, the private sector plays a huge role. Healthcare is a public good. And just as Ola has said, the public sector has to play a role each and every time, right? In 2001, member countries of the African Union came together and they pledged to increase the level of health spending to at least 15% of the government budget. Now, different countries at different levels of performance against that standard. And just for comparison, US spends about 22% of its budget on healthcare. The UK spends about 20% of its budget on healthcare. Nigeria spends only 4% on average of its budget on healthcare. And we don't expect that figure changes anytime soon. So in our context, in Nigeria, the private sector will play a pivotal role in really advancing the sector. But it is important that to realize that the public sector has a role to play, and that role is essentially to find ways to incentivize private sector investment in healthcare.
Of course.
With respect to education, look, what I'd say is this. Nigeria has not invested as much as it should in education. Comparatively speaking, we spend about 7% of our budget on education when our peers spend easily double that amount. But with that being said, Nigeria produces some of the finest doctors in the world.
And that is a bit of an irony, actually, when you think about it.
Exactly. So Nigeria produces some of the finest doctors in the world. Our doctors are celebrated the world over. We haven't done enough to retain the doctors that we produce or attract our doctors in diaspora. I mean, statistics show that between January and September 2022, about 1,300 doctors who were trained in Nigeria were licensed in the UK. Right? So the issue of brain drain is becoming an acute emergency for us, and we need to find ways to reverse the
Yeah,
trend.
and in fact, you call it a brain drain. I actually call it a brain sink because, COVID has sort of accelerated that particular trend. So, Dr. Lai, I have to come to you. This issue of the brain drain, perhaps a question, is it such a bad thing? Because we obviously are quite a populous country. If we can produce a critical mass of stellar professionals, the talent is global. Is it such a bad thing, number one? And number two, how can we ever hope to reverse this brain drain? Or should I put it in a different way? How can we retain more of our skilled professionals within Nigeria to service the healthcare space?
Probably, I kind of sit on the fence with my answers, but I'm not going to sit on the fence on this one. It is a bad thing. It's a bad thing for your doctors to be leaving the country in droves and leaving the healthcare system without doctors practicing in the hospital. It is a bad thing. Now, what can we do to reverse it? I'm not sure that we're going to be able to pay the same rates to a Nigerian doctor practicing in Nigeria as America will pay. Even British doctors leave to go to America because the pay is better. So that might be difficult for us to do. It's the same way that you're asking Kunle and Sons auditor that maybe only has one employee to start paying the same as PwC. It's not going to be possible because they just don't have the amount of money. For context, the UK probably spends about $200 billion on healthcare per year. That is Nigeria's healthcare budget for 200 years, simply because they have more money. They're a bigger country, they're a richer country. So what are the solutions to the brain drain? What can we do as Nigeria to make sure that we're retaining some of our skilled talent? Number one, I think that we should be looking at paying our doctors slightly more. I think that will, at least alleviate some of the difficulties because it is a pay issue. I think security is an issue as well. I think that people migrate not only because of pay issues, but because of security, education. So if we start fixing those issues, I think that we can get somewhere. I also think that task shifting is now becoming essential. So trying to train other professionals, other science professionals to do jobs that doctors would normally do. And that's been happening in the NHS, that's been happening in America for decades. It needs to happen in Nigeria. Otherwise, we are going to be left in a situation where the country can't deliver healthcare. Interestingly enough, Cuba makes more money from exporting their doctors, i.e. asking the countries that need doctors to pay them, than we make from oil and gas. Yep, you heard me right. Cuba makes more money from exporting doctors, which are their highest exports, than we make from oil and gas. At least the government take from oil and gas. So I think that there might be a situation where we can speak to our Commonwealth colleagues or our fellow Commonwealth countries, speak to some other governments and develop bilateral agreements where, the doctors that migrate in an orderly fashion and we get paid for it. And that way that money can be directly invested into our healthcare system. So I've suggested, number one, better pay, better overall conditions, including improving our education system and security. Number three, task shifting. And number four, exploring these kind of relationships and seeing if we can get something out of this migration. But my answer is no. I don't think that, doctors leaving in droves can ever really be a good thing.
Yeah, thank you very much. I mean, clearly we need to do quite a lot of out-of-box thinking there. But don't go anywhere because after the break, the deep dive into Nigeria's healthcare sector continues with Dr. Ola and Dr. George. Stay tuned.
So last year we produced a report called the Healthcare Unicorns Report on healthcare startups and their activities. And if you're interested, if you Google Healthcare Unicorns Report, you can probably download it. But I've been investing in healthcare startups since 2016. And we have a portfolio of nearly 30 healthcare and fintech startups across the continent. The areas that we're seeing the most innovation in, of course, as you can imagine, telemedicine, but also equipment delivery, telepharmacy, for instance, is also a big trend we're seeing, as well as teleradiology. Diagnostics is a really, really interesting area where we're seeing a lot of activity in terms of innovation, in terms of diagnostics, as well as service delivery. But across the entire value chain of healthcare, from wellness to diagnostics to logistics, we're seeing an uptick in investment, particularly post-COVID. And hopefully that will bring the costs of healthcare down. Because right now you see a trend where a country like America, for instance, invests $9,000 per person on healthcare. A country like Norway invests $7,000 per person on healthcare. A country like the UK invests $4,000 per person on healthcare. If you take the federal government budget only in Nigeria, we're investing probably about $6 per person on healthcare. It's very difficult to do with $6 what somebody else is using $9,000 per person to do. So technology is essential for really bringing the cost of healthcare down and helping us do more with less.
Thank you. Thanks very much for that, Dr. Lan. Great to have you on the show. Now, Dr. George, looking at some of these numbers and the gaps, what are some of the obstacles affecting long-term investment in healthcare financing in Nigeria?
Yeah, look, I completely agree with Ola. Healthcare is potentially a very attractive sector. I mean, if you look at Nigeria, the fundamentals are strong. What we have is a large underserved population with significant disease burden of both communicable and non-communicable diseases and relatively poor outcomes. So without any hard analysis, I mean, you will come to the conclusion easily that it makes sense to invest in the sector, but there are a couple of challenges, of course. First is, as I mentioned before, the lack of health insurance. A significant portion of all the expenditure in Nigeria is out of pocket, right? Nigeria spends the population of Nigeria spends 70%, out of pocket. That figure is as low as 9%, for France, 11% for the US, and 17% of the healthcare expenditure, only 17% of the healthcare expenditure in the UK is out of pocket. I always say that every family in Nigeria, I don't care how wealthy you are, every family in Nigeria is one health crisis away from catastrophic spending that could lead to poverty, right? And that's a significant problem. The other one is the lack of basic infrastructure. If you look at the financials of many of our diagnostic centers or hospitals, a significant portion of their expenditure is on power, and this is funds that could otherwise have been allocated to medical technology and skilled medical workers. You have challenges around the cost of interest rates at 20%, north of 20%. You have challenges with currency depreciation. In 2022, the Naira lost 23% of its value. So every investor, even before you start to talk about or consider the returns on your investment, you have to cross these two hurdles, right? And then there is the issue of the unavailability of skilled health workers, right? In Nigeria, you have 4 doctors for every 10,000 people. In the US, that figure is as high as 26. In the UK, it's as high as 30. In Brazil, it's as high as 18. So lots of opportunities abound, in the health sector, but indeed there are significant challenges.
Indeed, there is, everything is clearly connected to everything. Yeah. So I wanted to ask you about technology, because technology is meant to allow us to rapidly scale or leapfrog. What role do you see that playing in plugging some of the funding gaps, but also in terms of technology and actual service delivery in the healthcare sector?
Yeah. A significant role. I mean, digitization and digital holds the biggest promise to transform healthcare in Nigeria. If we were to follow the traditional path, to improving some of the figures I mentioned earlier, it'll take us a significant amount of time. It'll take us a significant amount of funds. I'll give you an example. Now, to reach the average per capita levels of doctors in Brazil,
which is what? Which is
18 doctors per 10,000 people, like I mentioned. Nigeria would have to recruit and train about 413,000 additional doctors. This will cost us about $28 billion, which is about 5 times our average total spend on healthcare annual.
Yeah.
And this is going to take us about 165 years with the current level of our training infrastructure. We simply do not have that time. So technology holds the biggest promise to leapfrog the traditional parts of advanced.
And what are some of these technologies specifically? Which ones are you most excited by?
Indeed, I mean, look, you look at telemedicine, right? Telemedicine is expanding access to care in remote areas, providing access to quality diagnosis and treatment, which is in turn reducing the delays and costs of care. If you look at AI is providing critical decision support tools, which essentially is a digital assistant looking over the shoulders of the doctors and providing essential second opinions that is improving the precision of diagnosis and treatment, right? And if you look at electronic health records, with electronic health records, we can piece together a patient's information from multiple touch points, from your CT, your MR, your ultrasounds, your vital statistics, your exercise information from your Fitbit or your Apple Watch, your nutrition information from your Fitness Pal, information about your weight, information from multiple touch points. And in so doing, we're forming the most complete picture of a patient, a digital twin as we call it. And then in so doing also achieving, truly achieving personalized care. And the fact that we can do this across a wide span of time also allows us to look at a patient's trend information, and in so doing ensure continuity of care, right? And also early intervention.
Yeah, I mean, this all sounds pretty sophisticated, and the statistics you actually quoted before were quite grim. But even that ability to deliver those services via technology depend on other types of infrastructure, such as mobile phone penetration, reaching the last mile. How much collaboration do you think there needs to be, and what are some of the partnerships that could really help change the narrative insofar as getting things like telemedicine, to the right people?
Right. Look, the health sector is quite a complex sector, and no individual company can do it on its own, right? So we're seeing partnerships between the traditional medical equipment manufacturers like GE and digital and information technology companies like Microsoft, like Amazon, right? We're moving, our archiving solutions from the huge servers we used to have on sites to all kinds of scalable cloud-based options, right? So we're seeing those partnerships across the board. We're seeing partnerships with financing institutions to provide flexible financing solutions as well to our customers. And we're seeing huge partnerships with government as well to incentivize the private sector.
And of course, GE Healthcare is here in West Africa because clearly you see opportunities. You're a for-profit business. So what is your sort of long-term ambition, giving the outlook for healthcare in the sector as a company?
Yeah, look, at GE, our purpose is to create a world where healthcare has no limits, really. To your last question, we see ourselves as, striving to be at the center of an ecosystem that is enabling access to affordable and sustainable care. GE has been in Nigeria since 2014, and we're in fact the only manufacturer to have a direct organization in Nigeria with a full complement of commercial and service resources to serve our customers. And we have a long track record of success that really proves our impact. And I give you a couple of examples. So we're providing access to quality diagnosis and care through digitization. 2 years ago, we supplied about 500, hand-based ultrasound scans. If you think about the traditional cart-based ultrasound, we've miniaturized that and put the entire, power into a pocket-sized ultrasound that is can be taken deep into the communities and linked and connected to specialist centers offshore. And in so doing, we are identifying, for example, early complications of pregnancy and intervening way ahead of time. We're partnering with governments, to place advanced medical technologies throughout the state, leveraging innovative financing solutions. So we did that in Borno State, for example, in the height of the insurgency. Borno State has one of the most modern pieces of medical diagnostic equipment today. And we're also partnering with international funding organizations to improve health infrastructure at sometimes municipal or national scale.
Yeah, I mean, quite incredible to see how healthcare technology can help solve social development problems. Thanks so much for your thoughts and insights, Dr. George Uduku of GE Healthcare West Africa.